The Fertility Podcast is here to help you understand more about your fertility, and for the last 8 years has published a lot of conversations with experts and people sharing their stories. It's now going back to its roots, giving you people's lived experiences once again to give you comfort in knowing there's a community of people who get it, so you find commonality, be inspired, and know you're not alone. Started by me, Natalie Silverman, a former patient, once I was pregnant after fertility treatment, I later joined forces with Kate Davis, an independent fertility nurse consultant, who is now your host. And here she is. Hello, it's Natalie, who you may know if you were previously listening to the Fertility Podcast. If you're a new listener, welcome. Just to explain, I started the podcast, as you will have heard in the trailer if you'd listened to it. Kate is now hosting it, but she's lost her voice. Bless her. So I got this message from Kate to say, I can't record my intro. So you've got me, just to explain what you're about to hear. Now, Kate has had a busy week. Despite losing her voice, she was working with us at Fertility Matters at Work, which is what I'm focused on now, hence not recording the podcast on a regular basis. And Kate was hosting a live event with one of our clients talking about endometriosis and the impact it has on people in the workplace. So it's really worth knowing that if you are wanting to have conversations in your workplace about some of these reproductive health issues like PCOS or endometriosis, it's something that we at Fertility Matters at Work are doing with Kate. We also did one just the other week about period health. So it's something to think about if you are involved in maybe organising some conversations in your workplace. We can help you. Now, what you're going to hear in this episode is a conversation with a lady called Rachel, because Kate has been doing an amazing job at sharing patient stories. And to give you a heads up, there is going to be discussions about trauma and fertility issues. And I just wanted to give you a warning to say that it does discuss domestic abuse and infant death. So it's a very poignant conversation. If it's not quite where your head's at the moment, totally understand. But do subscribe to the podcast so you can stay up to date with everything that Kate is sharing with you. If you are continuing on listening, this is a brilliant conversation, insightful as always from Kate, and I do hope that you enjoy it.
So hello, Rachel. Welcome to the podcast.
Thank you very much. Thank you for having me.
Oh, it's great to have you here, and having kind of had some communication on Instagram and read about your story,
Yes.
well, to be honest, I have to say, when I first read it, and I'm not going to give anything away because you're going to tell us all about it in a minute, but when I first read it, I actually had to keep reading it a few times because I couldn't take it all in, everything that you've gone through and everything that's happened in the last few years for you, or in fact, more than a few years, a number of years.
Sure.
It's been really incredible. And I just think inspirational as well. And I'm really excited that we can hear more about your story and that we're sharing it today. So thank you so much for being willing to talk about it.
Okay, thank you.
So, Rachel, do you want to start off then and just tell us a little bit, give me a potted history of where it all started?
So I was about 16, grew up in a family where, we had a lot of changes, bereavements. My father passed and my mum remarried. And when she remarried, she converted to Islam. And there was a lot of pressure for mostly me, I think, a little bit for my younger siblings. And as I got to around the age of 16, I rebelled and started a relationship very quickly, and very quickly became pregnant. I had 2 children from that relationship. Again, because of of the pressures that we had, I actually got married to that man. It wasn't long after my first child, my son, was born, that we realized, and I say we, but it was with a lot of the support from my mum, that things weren't, he wasn't developing as he probably should have been. He would kind of jump when we were, feeding him, weaning him, as if he wasn't seeing the spoon coming towards him. So there were little things that were happening, and, I'd go back and forth to the doctors and really had quite a difficult journey. But by the age of just over a year old, he was diagnosed with a terminal illness called Tay-Sachs disease.
That must
Yeah.
have been incredibly traumatic, because not only you're there with your son, who's
mm,
clearly you're concerned about is not developing the way that you want to, but you're young. And did you find it
Yeah.
was difficult for you to make yourself heard by the
It was
doctors initially?
so difficult, Kate. I was fobbed off. I was told I was a young mom. I was told that, I was breastfeeding him at the time, and he was really sick. He was vomiting so much after his feeds, and I was told, he's breastfed. This happens often to babies that are breastfed, and I didn't know the difference at that time. That actually sometimes it's babies that are bottle fed that tend to be more sick. But I was literally having journeys back and forth to the GP until my mum started attending with me, and we was able to be seen by a pediatrician who then referred us for an eyesight test at the opticians. And that's when a cherry red spot was seen at the back of his eyes, and it was automatically flagged up that this was connected to Tay-Sachs disease. And so the pediatrician then sent him for a blood test. They didn't give us any more information, so we went away and probably shouldn't have, but started doing all of the researching and trying to find out what this is.
But
Um,
sometimes you have to empower yourself, don't you, and get that knowledge when perhaps you're struggling to feel that you're getting answers.
this is it. But sometimes not knowing and then knowing, but all those Google symptoms, and I can't remember if Google was a thing in 2002, but I just remember,
Maybe just about.
yeah, searching. And when we had the appointment in January, it was confirmed that he had Tay-Sachs disease and that we would need to be seen by a specialist at Great Ormond Street Hospital. Was literally within a week. It was so quick. And we was told at that point that he would have anything from a year to 4 years to live. But if he was to live for that long or that length of time, that he would digress. He wouldn't be able to see, he wouldn't be able to hear, he would have no movements. And it was just, to be told that I was just in a bubble. I remember just feeling totally numb as if it was happening to somebody else. And we left the room, and I remember his dad was absolutely distraught. And I was comforting his dad, not even taking it in myself. And then kind of just being on this mode where I'm going to capture all the memories, I'm going to do all the great things with him in the short time that we had left. But at that time, I also had my daughter who was about 6 months. So then we was then told that she needed to be tested because maybe she was a carrier, maybe she had this terminal illness as well. And there was just so much new things. We referred to speech and language therapists, portage, physiotherapy. It was just a lot. But he lived after that appointment. He lived until the December that year.
Oh, I'm so sorry. That must have been, I just can't imagine at a young age having to go through all of that. What then, kind of what went on then? How did life move on after you sadly lost your son?
Yeah.
What then happened?
So, unfortunately, I think now being a lot older, I'm able to reflect and have a different kind of perspective. But his dad never accepted that our son had a terminal illness and would pass away. And so when he did, it literally destroyed him, and he became really angry, and that anger then turned into violence towards me. There was quite a lot of significant
Hmm.
domestic abuse. It was hard. I didn't want to share that with my family. There was a few of my friends at the time that I could speak to, and I was able to be directed to support and have.
How long did it take you before you actually reached out and got help then if you felt you couldn't
Um,
share it with a family?
because of the incidents were quite severe, police were involved, social care initially, so things were flagged up quickly due to those processes. And and I accepted the support immediately, and so the relationship ended probably about 3 months, 4 months after my son passed away. But then there was that slow transition, feeling like I had done a lot of the journey and the care for both of my children independently of him. And so it was just recognizing that I had that strength to then finally say, I don't want you, in this house or in a relationship, and you need to leave. There was a lot of accusations against me. It was really, really, really difficult. And it's only now knowing that that is a really high risk time for women or even for men when they're trying to leave a relationship.
Absolutely.
So
So you mentioned about you reflected a lot, and did your experiences of that really difficult time in your life then give you the motivation and I guess the inspiration in which to further your career? Because I know, having
Yeah.
spoken to you and know what's been going on, I know what you then eventually went into. So tell us, was that the catalyst that made you think, I'm going to develop myself, I've experienced this, I've got something to give, something to share? Was that the catalyst?
Absolutely, absolutely, Kate. Being able to look back, how grateful I was that on the journey, even with my son, I'd met so many other parents who had children with disabilities, some lifelong disabilities. I'd met mothers who'd been pregnant and had stillborns or had lost babies. I just felt that I was so lucky that I'd been given a kind of timeline that, my son is going to pass in, and I was able to, gather those memories. Then we was also introduced to so much support that it made things 100 times more manageable. And then also with what happened with his dad and the violence I experienced, the support again from professionals was out of this world. And I just felt like this is what I want to do. I want to be able to give back, but I also want to be able to support those who may not have that voice, don't know what to do, or don't have that family support. And so I started a course to become a social worker.
Amazing. Congratulations. That's amazing. I bet that has
Thank you.
changed your life professionally. And I bet you feel that whilst when you were 16, you were young, you had children, you
Yeah,
didn't have time for you. I bet this has been now something for you, hasn't it?
yeah. Definitely, it's I think social workers do get a lot of bad press because immediately as you hear the word social worker, you just think of these professionals removing children from families. And that was when I got into it, I thought I'm never going to be that kind of social worker. I'm never going to work in child protection. And I stayed clear of it for years. And I literally worked in every other area possible. And, as social work has evolved, so have I. I work now in a mode where you're supporting families and you're helping families to remain together. And if there are those worries, can we support you to address those worries? Is it something that you've had this trauma and experience in your own life as an adult? Have you had your own childhood, worries and experiences? And we now can work with you to kind of, do you need counseling? How can we address that so that your children can stay with you and have a better childhood? And it's not just about that, but working with children in care. There's so much different aspects. Children with disabilities.
I think it's a
Okay.
great career to go into, and like you say, lots of
Yeah,
opportunities. So if we then fast forward, you've developed this lovely career for yourselves, you then
yeah,
find a lovely man, remarry, everything's,
yeah,
looking good, going swimmingly, but then
yeah.
you hit another hurdle, don't you?
Yes. So I remarried in 2017, which was something I never thought I would have done. Unfortunately, in 2020, he lives abroad. He was at work and there was gunfight, if you like, a shootout. And as wild as that sounds, he was hit in the neck by a stray bullet.
By a stray
Um,
bullet.
a stray
What are
bullet.
the chances of that happening?
Well, this is it. And I still want to say he was lucky because there was somebody behind him who was also hit. He lost his life.
Oh my goodness.
We're lucky that my husband
Yeah.
is alive and he's
Yeah.
here. But the impact of that injury, of the gunshot wound, it temporarily paralyzed him. And then the road to recovery over the last 3 years now, I can say, has been slow but steady, and having to try and access healthcare and support in Jamaica is really difficult. You don't have that NHS service. It's so difficult, it's costly. And a lot of the time, you start to meet other people that have had similar injuries or just accidents and injuries where they have sustained disabilities and they just haven't had or been able to access the appropriate care and then have lifelong disabilities that they have to live with just because the simplest of care they were unable to access.
I can't imagine it must have been so traumatic. And you mentioned that he's now in the UK with you, so hopefully that's helping rehabilitation
Yeah,
as well. So then, obviously, the obvious thing is, isn't it? Then you're with this wonderful man, this lovely partner. You're very
yeah,
happy. What is it that you want?
yeah.
You want to then
Yes.
have a family together. So that's the next hurdle that we find.
And this is it. This is it, Kate. So, my daughter, she'll be 20 years old in the next 2 months. So, I almost feel like I'm worn out. I'm a lot older, but experienced.
Absolutely. That makes all the difference. My
Exactly.
sister and I have a huge age gap. We're 18 years between the two of us.
Oh,
I know,
wow.
massive.
There's
I have a
much.
brother in the middle,
Yeah.
9 year gap between all of us. So I can understand what it's like to have that age gap. So yeah,
Yeah.
yeah. Okay. So
Yeah.
carry on then.
So,
Tell me about the next
yes.
stage in your life.
We decided that this was something that we wanted to pursue. Kind of assumed that it would have happened quite quickly. Over the years, with my career, with my lifestyle, I'd put on weight. I'm a lot older. And these, I started to find out when it wasn't happening straight away, that these were possibly some of the things that may have been hindering my journey. A lot of my initial trips to the GP, we're doing the deed, but nothing is happening. What's going on? And okay, you need to lose weight. You're much older. Your job, your career is a very stressful one. You need to make these changes. And then if nothing's still in 6 months, come back again. And it was like this cycle of, okay, this isn't happening. These are the issues. It's not so easy to lose weight. This is my career. It's not so easy to just click my fingers and I'm no longer stressed out.
Totally.
How do I, make these changes? And we did wait for a long time. And I've kind of, over the last few years, also kind of experienced, and I even want to say suffered with, really heavy and painful periods. And that was something that I've always kind of been going to the GP about on a separate issue. Why are my periods like this? For a good few days prior to and after my period starts, I'm really unwell. I'm lethargic. I'm in so much pain. I literally, I'm in bed. Pain relief doesn't help. The flow is very heavy. I could be out and have accidents where I'm messing up my clothes. It's just
And that's
embarrassing.
just, I mean, it's not fun. And no, I feel really strongly that no woman should ever have to
Mm,
suffer with
yeah.
heavy, painful periods. There's no
Yeah.
excuse. And I think, sadly, in our culture, there is that
Hmm.
acceptation that we put up and shut up. And I know that,
Definitely.
Natalie and I have talked about this on the podcast before, and this shouldn't happen. You shouldn't have
Yeah,
to put up with
exactly.
heavy, painful periods because it's not normal. And there's assumption that,
Right.
oh, it's normal. And sadly, the medical profession perpetuate that myth as well, and we don't get the care and the support or the referral to the experts that we need.
That we need.
Yeah,
Yep.
yeah.
This is it.
So where has that all left you then on trying to conceive and have this much desire for family with your husband?
And this is it. You feel like you're lost. You don't know who to speak to. You kind of reach out. You start on Google, and then I came off of Facebook a long time ago, but I have an Instagram account, and it was by chance. I can't remember what it was that I Googled.
And please do share your Instagram handle because your Instagram account is very
Yes.
lovely and I think everyone should be following you.
Thank you. It's dancing in baby
Thank you
dust.
very much.
I found a community where many other, and I'm not even going to say women, because there's men, couples, single parents, or men and women that want to be single parents that are just desiring to have a child, to have that family. Everyone kind of having a really difficult time with infertility, and the community. When I found it, I was like, wow. And I didn't really want to join with my own personal account because I just felt that there was this taboo and really difficult. Maybe people didn't understand as much, or to kind of start talking about something so intimate and sensitive. And that isn't just, as myself as a social worker or as a mum already, but it was also, in the culture that we've kind of grown up in and that my husband is from. There is a kind of perception that, you shouldn't be infertile. Just drink this, drink here, or just eat this, strengthen up your back and have a child. So when you face with infertility and you can't give your husband a child or your husband doesn't give you a child, it's almost like you're doomed, and it's a horrible, horrible feeling. There's a lot of expectation.
Does that blame, have you noticed that the blame has come from your husband's side of the family? And is that blame
Yeah.
portioned more at you or is it portioned at you both equally? How does that work?
I think that is from the husband's side of the family, although my own family have that side of things as well. I think it's not as imperative because they're British born and they're over here. Whereas, my husband he's just come over from not long been in the UK. It's very much that, there's that kind of unspoken culture, if you like, and it's almost like looked upon initially as the woman, But then it kind of then leads into the man. Well, how comes it hasn't happened? Why is the man, what's the man lacking that he hasn't done that?
Because I think in general, kind of society, and maybe that's changing as kind of male fertility is becoming more talked about and understood.
Yeah.
But I think people do assume that the problem lies initially with a woman. And I can say from my own perspective of consulting many of my patients, I will often see a woman who will absolutely say, "Yeah, no, I've got PCOS, so I know it's my fault." And then when I dig deeper, I find out that the partner hasn't had a sperm test. So I'm like, right, okay, I understand that you're concerned because of your own condition, but until we actually know what's going on with your partner, there could be a male fertility factor there as well. And it's something that we do need to investigate. But I think there's often that block there in for women themselves thinking, well, it has to be my fault. It's my body. It's my womb. I'm not able to fulfill this very basic need. And there's a lot of blame there.
Yeah, I do feel like that as well because I said initially I started, approaching the GP and it was like, okay, we can, because you've already got a child, we can offer you some of the investigative tests on the NHS, but we wouldn't be able to offer you treatment. And the focus was solely on me at first. Let's look at your egg count, your AMH levels, also known as let's look at your blood work. All of this, it was like, okay, and my levels were coming back really well. What else could it be? Still this whole thing of you need to lose weight, you need to lose weight, you need to lose weight. It's drummed in your head until it almost feels abusive. And even again, just being on Instagram and finding we've got I think she calls herself the fat fertility coach,
Nicola Salmon,
Nicola
yes.
Salmon. Absolutely amazing. And her book and her kind of theory has just, not even her theory, it's just changed my whole perception. And
Good.
as I said to you, I like that kind of thinking of the cup is half full.
Yeah.
Let's be positive and let's try and remain positive. And she does that. And it's not about, she talks about statistics, she talks about research, and it gives you that reassurance and confidence that it's not, solely about your weight.
Absolutely not. And I think, it's so important to look holistically and look at everything. I think it's so important not to ignore the fact that, yes, evidence and research does show us that women who are carrying extra weight may take longer to conceive, but it's the way that it should be dealt with in a sensitive
Yes.
nature, not in
Yes.
this kind of fat shaming.
Right.
And I know Nicola uses the word fat very easily and it
Yeah.
trips off her tongue. I
Yes.
find it difficult to say that word because I feel I don't want to insult anybody or make anyone feel bad.
Yeah.
But it's that fat shaming, which I know is a term. It's
Yeah.
that blaming, and it's trying to avoid that blame culture and dealing with it in a really sensitive way. But equally, it's not the only thing. I always talk about a puzzle, and there's lots of different pieces that could be missing in that puzzle. There's
Yeah.
never just one thing. There's lots of different things that you have to put in.
I mean, even with that, just looking at different kind of ways. So that was something that was brought up by the GP. They were talking about de-stressing, and I've always been someone who's loved to exercise and use the gym, but because of my career, I've never really had enough time. I'm not a morning person. I've tried getting up at like 6 a.m. to go to the gym, but never have kind of incorporate that into my routine. One of the things I did start was a course of, or trying out acupuncture and reflexology, and I found it absolutely amazing. It was fertility focused, again, so I could go in and it was almost like, I don't know if anybody watched Fraser. I might be
Long
showing
time
my age
ago,
a bit too
yeah,
much,
long
but
time ago.
yeah, going in and sitting on the sofa
Yeah.
and having this
Moment for
a
yourself.
debriefing.
It's for yourself,
It
isn't it?
was a safe space, really calming. We had the dehumidifier going off with the lavender scents and the plants all around, and
Nice.
we go through our charts and look at when are you ovulating, what's your temperatures look like. Okay, then we're going to focus the acupuncture needles on this area today, and we're going to do this. Okay, get in and we have the foot massage and we de-stress and we book. It was absolutely amazing, and that was with Hannah Pern. She's in Streatham. She's got a clinic in Streatham and Balham, and I think it was, on top of everything of this journey, it's something that's really supported me because it has helped me to really de-stress, and I am a firm believer in self-care, and I think that's so important whilst on this
What you've
journey.
just said there leads me really to my last question for you. And already you've given some great advice and tips. But
Yeah.
what is the one thing that you wished you'd known about way back when that would make a difference or could make a difference to your fertility journey now and that you would like to share with
Mhm.
our listeners?
Just thinking about it, I think, we almost take for granted when we're younger, and we've come out of school and we're told that you're intimate with your partner, and then 2 weeks later you take a pregnancy test and you're pregnant. And it isn't like that for so many people. Infertility is real. And I would just say that there needs to be more focus on women's health. It's not a quick fix in terms of, okay, let's give you the pill, you've got heavy periods, or you've got facial hair in places that you shouldn't have, let's give you the pill. It's about having those investigations from early. I think in a relationship, it's not just be about the woman. So, arrange that sperm analysis from earlier on. And also, even if possible, consider freezing your eggs, because we just never know what our journey is going to entail. And, as for me, I never would have thought that I would have been a social worker. And, I'm approaching the age of 40 now. I've got a child who's nearly 20 and I want another child. So that is unfortunately a factor that is against me, age. But, if I was aware of some of these things before or earlier, I would have been able to make a different plan and had all of these things to consider so I could make an informed decision. And I think that's the greatest thing.
I absolutely agree with you. I think that's the greatest gift that we can give young people, is to give them the knowledge so that they're empowered with their health and with their fertility, so that they can make the sensible choices in the future. Rachel, thank you so much for
Definitely.
telling your story on the Fertility Podcast. I massively appreciate it. It's been so interesting listening to everything that
Okay.
you've gone through, but equally everything that you've become as well as a
Yeah.
result of what you've gone through. So thank you for
Yeah.
sharing that. It's been amazing. I really, really massively appreciate it. I wish
Okay.
you
Thank you.
all the best going
Thank you.
forward. I really do hope that you're able to continue to create that wonderful family.
Lovely. Thank you so much. I really appreciate it. And the space as well.
You're welcome. Well, wasn't she just lovely? It was fabulous to talk to Rachel, and so interesting to hear how her experiences have then really instilled the desire to train as a social worker and to understand more about that whole arena. Was just fascinating. I think what was just really interesting to hear when I asked Rachel about one thing that she wished she'd known at the very beginning of her fertility journey, and it was to understand more about her fertility and to feel empowered at an earlier age. And obviously, she was facing getting pregnant at a really young age, and then all of the trauma and heartache that went on for her through all of that as well, which you just can't imagine at that young age dealing with that. So I think it's really important that we all feel that we can become empowered and knowledgeable in our fertility. So she made a really valid point when I asked her what one thing that she wished she'd known more about at the beginning of her fertility journey. And it was the desire to understand more about her own fertility and women's health. And so she could make the right choices. And I think that's so important for us all to be aware of. I often talk about the need to feel empowered about our fertility. And the earlier you can find out that information about yourself, even if you are not necessarily wanting to conceive straight away, but just to have that information to become knowledgeable and empowered and understand more about fertility and women's health, so that you can be a step ahead maybe. And often think about, not delaying going to see your GP and getting some investigations. Rachel talked about going to get a sperm test done, getting those things done early so that you've then got options. And she also talked about egg freezing as well, and making that decision to do that if that was where you are. And so it's all these things that I think we just don't talk enough about. And that's because they're shrouded in taboo, aren't they? As you'll know, Natalie, now that she's taken a bit of a sidestep from the podcast, is doing loads of work with the other two girls from Fertility Matters at Work and talking to organisations about fertility in the workplace. And I'm also doing the same with the organisations that I work with. So we're getting the word out there. We're breaking down the taboos in the workplace. It's starting. There are conversations that are happening, which is great, but I still think we need to talk about it together. And one thing that I'd urge you all to do is talk about fertility, talk about pregnancy loss with your girlfriends and your boyfriends. Get talking about it, get chatting about it. We're starting to talk more about menopause, which is fantastic, but we need to be discussing fertility more. So I know it's difficult and sometimes it's really hard to start those conversations, but the more we talk about it, the better. And what I always find is once you open up that subject, it's amazing how many people will say, oh yeah, no, I've been struggling to conceive, or yeah, I experienced a miscarriage. So just get those conversations out there. So that's one thing that I would ask you to do. If you could do that for me this week, start a conversation about fertility with your girlfriends and your boyfriends.
Please do rate and review the podcast, as it's brilliant for other people to know what you think. Even just hitting follow or subscribe wherever you're listening to this podcast really helps other people know it's worth a listen. Also follow Kate on her Insta, which is Your Fertility Nurse. And if you'd like to book in a consultation with Kate to understand more about your fertility and reproductive health, visit yourfertilityjourney.com.